Hi, my name is Dr. Neil Alexander Pass. I am in London, UK, and I am dyslexic myself, and also have just been diagnosed with ADHD. And I am a educator and a researcher, and I've written a few books on the topic of school-based trauma and and also the school to prison pipeline. Yes, of course. So, I've been writing two books each summer break, as I'm a teacher for the last I think about 10 years. So I'm up to about 18 or 19 books, and I've wondered why I've never been able to relax. I said I have a really poor short-term memory, and I thought over the summer or to the later part of last academic term that really there is something more. So during the summer, I began to talk to my therapist about it, and we thought yes, maybe there is ADHD. So I went to my GP in the UK, and I asked for a referral, and I was seen within like 2 weeks, and I was diagnosed, and I came out with a combined subtype. So that means there are three LMC subtypes. You're either with a LMC attentional difficulties, or with hyperactivity and im and im im impulsiveness, or there is the combined. So I've come out as being strong on all of those, and I've been on medication for the last 4 weeks, which which is quite a weird. My wife wasn't pleased for me to go onto the medication, but I've been doing research with people with ADHD for the last 5 or 6 years, so I know that meds can be a very positive way forward. In fact, within the UK, there are more adults having obviously prescribed uh, med, med medications for ADHD than there are for young people. So I was quite fascinated about which a bit of my traits were dyslexia based, and which ones were ADHD. So me- memory is a big thing for me. I've got a shocking memory. So I will lock the car. I will use the fob. So I see the lights go on, and within 2 or 3 steps, I've really forgotten whether the car is locked. So I go back and I check 3 or 4 times. It drives my wife crazy. So there is that, the short term memory, also the just not being able to calm down, and the processing. So I think that the short term memory, which I first put down to the dyslexia, could be ADHD based, because it's the ex, executive processing. The not being able to be calm must be ADHD based. I think my poor spelling is dyslexia based. I think that my sleeping difficulties must be ADHD based. So I've tried medication for the last month now. First a month, a first first week a lower dose. I'm on Elvance, so I began with 20 mils for the first week, and now I'm on 40 mils. But I believe it can go up to a top dose of I think about 70 mils and milligrams, and this is a slow release. So it's quite weird because I thought it would have a positive effect, but I'm unsure. Um, for the first few weeks, there was a brain fog and and some headaches. Um, I feel it has slowed me down at work. I'm not able to do as much as I would cram in a huge amount per day. Now I leave each day and thinking, so I've not done enough, or I should have done that. So certain things are slowing down. I've lost weight, so that is a bonus for me because part of my ADHD traits are to need to fidget and to uh, hold things, and the biscuits. I will see a packet go within without any thought. So the I think that the fidgeting with the food is a lot better. The medication is making me feel full, so there is less need for that. Um, yeah, so the headaches have gone. The brain fog is there, but I'm like slowing down. It's quite. I am trying to finish my latest book on dyslexia, art and uh, and school-based trauma, and I've got one page of things I need to find references for, and I'm putting it off. So in some ways, I'm unsure whether the ADHD meds is making me feel more like someone with ADHD or less, and whether it is down to the dose level. But it is it's quite odd. Am I surprised? Yes. Am I? I didn't know what the meds would do. I didn't think that the meds would would do this. The weight loss I am pleased for. I've lost 7 pounds in one a month, so I'm pleased for that as I am overweight because of the binging with the biscuits. But yes, I'm unsure. I'm still in a very early phase. The so I went for a 4 week review last week, and they wanted to up the dose, but said no because I was still having some headaches. So maybe I need to go up to the next dose. Un, unsure. But yes, it's a weird journey. It's I I part of my journey towards this was doing research to find out why, and I'm saying enough isn't enough. So I wrote a research paper, as that's my thing. I will write a lot, and I researched five billionaire on neurodiverse on entrepreneurs. So it was research paper. It is from a journal based in from the Dyslexia Association of Singapore. Um, and it looked at Elon Musk, Bill Gates, Jeff Bezos, Branson, and also Dyson. So I looked at why they don't stop. So similar to me, why they don't stop, and enough is never enough, and that I was quite fascinating. So I then developed that to, to a book to look further. So my journey towards the ADHD and making sense is has created a paper and now a book, and that's just gone off to the publishers, and that's looking at diverse on entrepreneurs, and it's talking about school being the motivation, so school based trauma being the motivation. But like me, they they want to do more. It's not enough to go and work in an obviously company. In certain fact, they struggle to stay within a job in a normal obviously company, and that's something I found as well. It's the struggle to uh, having the difficulties that being neurodiverse brings, the impulsivity, the fast working, some at times careless errors, and that can mean you don't fit in well within a normal NMC structure. So I was passionate about special needs in my jobs as a teacher, but that passion made made me fall out with the leadership. So I changed jobs every 1 or 2 years. So I can see that my neurodiverse um, neurodivergent traits of the ADHD and the dyslexia meant really I wasn't suited to that sort of a, a leadership role within a fairly rigid and setting. So like me, many on entrepreneurs, they want to do more and really create something that works to their LMC strengths. What does it mean to me? I think it means that I can relate to my research subjects better because I do research within dyslexia as well as ADHD. I think it means to me a chance to show that you can be different and that's okay, and that you have great strengths to share with the world and to show the younger generation that it shouldn't be seen as a deficit. It should be seen as a an strength, and that the you can shatter this perceived glass ceiling.